a host of other channels. Thank you for joining us today. I have with me Dr. Taoffic Majolagbe, and we will be discussing a very, very important topic. We want to talk about road traffic accidents and the victims in Nigeria. Dr. Majolagbe, welcome to the program.
Yeah, good morning, Dr. Ogunremi. Thank you for having me.
Yeah, thank you so much for joining us today. Please, can you introduce yourself to our audience?
My name is Taoffic Majolagbe. I'm a medical graduate from University of Ilorin. I presently practice with the Lagos State government. I practice as an emergency room practitioner with several years experience in trauma. I provide advanced trauma life support, um, provider, and an instructor in the ATLS.
Thank you so much. And accidents is a major thing. Maybe we'll start by defining what accident is first, and then we can go into the nitty-gritty of the day.
Well, by simple definition of the word accident, we talk about something that happens unplanned, right? And it could be various forms, you understand. With respect to what we are trying to discuss, we are discussing that aspect of accident that has to do with the road. So these unexpected events, unexpected, unpleasant events that happen on the road are the ones that we call um, road traffic accidents. And basically, the um, the injuries that you suffer as a result of that event is what we call the road traffic injuries. So the term road traffic injuries is commonly used now to describe what happens on the road when you have these unfortunate events.
Okay, thank you so much. So you said something. You said an unpleasant event. Obviously, I think one way or the other, we've all been, by your simple definition, most of us will have been involved in one kind of accident or the other. But we're talking about a road traffic accident today. And then when you talk about it being, unpleasant, why is it unpleasant? I know that's a very, very interesting question, but what makes it unpleasant?
Well, it may sound funny, really, but we all know that the sequelae of accidents on the road brings about a number of consequences.
Mm.
The least that you would have are just psychological disability, disturbances alone. Beyond that, people will have injuries. Some of these injuries are survivable, some of them are non-survivable. So meaning that you also have fatalities as a result of these events. So definitely these are unpleasant things that there's always a cause for us to find a way to address them based on the enormity of the problem of the road traffic accident.
Okay. So what causes road traffic accidents?
Well, before that, before we go to that, I want us to first of all understand the enormity of the problem of road traffic accidents. And I'm
Okay.
going to start from a global perspective. Um, Globally, according to the United Nations reports as at 2015, which showed that over 1.2 million people die annually from road traffic accidents. Over 45 million people are affected, are victims of road traffic accidents, and that actually is very enormous. You will understand it when you actually then place it in economic perspective. It's been estimated that between 3
Mm-hmm.
to 5% of GDP is the cost of road traffic accidents across various parts of the world. More interesting too, and more disturbing, is the fact that Africa actually shares the larger burden of these fatalities and morbidities from road traffic accidents. Um, and the biggest victims are the a part of the road users who include the pedestrians, the motorcyclists, and those who use the bicycles on the road. So if we look at that enormity, and the fact that the number was actually increasing, and there was a projection that there was going to, it might double by 2050. So there was a need for the United Nations to take an approach, a global approach, to stem the tide of this increase. So at the United Nations General Assembly of 2010, a strategy was launched to address the scourge of road traffic accidents, road traffic deaths across the world. And this strategy is known as the United Nations Decade for Action, which is expected to last between the span of 10 years, between 2011 and 2020 that we are in. So there are about 181 participating countries, in which Nigeria is one of them. So the essentially this decade of action looked at this issue of causes of road traffic accidents, and we could look at essentially three parts. We could divide them into three parts. One of them is user behavior, the behavior of people who use the road, and this could include those who are in vehicles, like the drivers of vehicles or passengers in vehicles. It also includes those who walk on the roads, the pedestrians. It includes the cyclists and those who use the motorcycle. So the behavior of the people on the road is actually one of the things that lead to road traffic injuries. And it might interest us to know that indeed it actually shares a a larger percentage of the causes of the accidents on the road, the user behavior, be it, I mean, whichever category they find themselves. The second aspect is the vehicle itself. You'll agree with me that when you have a bad vehicle, there is that tendency that these unexpected, unfortunate events would occur. And thirdly is the road infrastructure itself. With bad roads, it is more likely that we would have this event. So these three things are the major classification of the causes of road traffic accidents. And number one, which is the user behavior, actually shares the larger percentage of incidents listening to road traffic injuries.
Okay, thank you so much. That's quite explicit. So we have, the road user, we have the road itself, and we have the vehicle through which we move on these roads. Now, so in developing countries like Nigeria, for instance, we're talking about Nigeria today. Road traffic accident, just like you mentioned, is a major cause of even death. None that would say, I mean, out of the non-communicable causes of death, I think road traffic accident seems to be one major burden in our country. What are the things that we can do, if we look at what this parameter, I mean, the three likely causes that you've mentioned. Excuse me.
Sorry.
Thank you. What can we do to actually prevent this, terrible incidences that happen on our road? What I know that's a very big one when you look at Nigeria as a whole, because we talk about the road is a major. You talk about even users' behavior, it's a major thing, because we didn't go deep into that. I want us to just look into those, and then we can see how can we tackle some of these, related factors that leads to the road traffic accidents in our society.
You see, sincerely, the decade of action is a strategic approach that has been presented to address these problems. Ideally, it should have been easy for each participating country to just plug in to various aspects. You just domesticate the standards that has been provided, the framework that has been provided, and then you could go into it. And I mean, recall I said the decade is supposed to end at 2020. We are already at 2020. So indeed, what we should first ask is, what have we done? How well
Yeah.
have we fared in the last decade with regards to this intervention? You see, it is I said before that the developing countries actually bears the burden of this disease. In Nigeria, according to the Global Status Report of 2015, the data showed that we had about 35,000 people that died from road traffic accidents, from use of our roads. 35,000 deaths means we have about 4 people who died every hour. So, I mean, for us to really understand how serious it is, about 4 people died every hour, every day, throughout the day, using our roads. And definitely, that's something that's, I mean, so unbearable. If we look at, I mean, this cost as well, we will be talking about billions of dollars that is lost, direct money being spent and lost in man hours. So how well have we fared? I don't think we have done too well. I don't think we have done too well. Let me tell you, the approach of the decade of action is supposed to rest on 5 pillars, or indeed, we may say that there's actually supposed to be 4 pillars and an umbrella. The umbrella is that each country is supposed to have an administration for its road safety. So there are a lot of legal perspective. There's a lot of administrative perspective that is supposed to come into it. And the expectation is that you should have a national agency that is dedicated to administer road safety. Yes, in Nigeria, we have the Federal Road Safety Commission, which indeed we would say has done quite a lot with regards to managing road traffic accidents in Nigeria. There are a number of other government official agencies and paramilitary that has also helped out over the years. But the FRSC is recognized as our own lead agency. So the 4 pillars that we're supposed to address are: number one, this user behavior, right? And then what are the aspects that we need to address there? Speed. Speed is about the single most important contributory factor to road traffic accidents. And I want us to say that, let's say each time we mention road traffic accidents, let us look at it as road traffic deaths, so that the imports can actually really be deep in us, right? So
Yeah.
speed is the major, single most important contributory factor. The other factors that you have are those of drug driving, intoxication, and other things like that. And perhaps users who also do not have the requisite knowledge to use the road. And apart from that, you also have, apart from the drivers, you look at the passengers, use of seat belts and other things like that, overloading, even pedestrian crossings. People cross the road recklessly. You find expressways, overhead bridge to cross, and right at the foot of the bridge, that is where people will cross. So these are reckless behaviors that actually contribute to this burden. You get, so we have that. So the user behavior, a gamut of things involved there. The second thing is that we should have road vehicle standards, right? There are 7 parameters that are supposed to be part of the vehicle standards recommended by the United Nations to do as much as possible to reduce these fatalities. 4 of them has to do, 5 of them has to do with our cars, and then 2 of them with motorcycles. For the cars, it is important that we have standards that will reduce fatalities from crash. For instance, things like buffers in the side impact buffers and front buffers. You understand? So these are some of the things that are expected to be in vehicles: seat belts, belts that would for children who would use carriers. There are certain standards that are supposed to be there to ensure that these carriers are anchored to the frame of the vehicles and other things like that. And then you have bumpers that are softer, so that their impact of when you have collision with uh, pedestrians, it can reduce the impact of the trauma. The other things are those that, I mean, concerns motorcycle. One of the regulation is to ensure that motorcycles have daylight. Um, their headlamps are on throughout, even during the daytime. It's expected to serve as early warning signals for other road users. Yes, and the other aspect is there are supposed to be some systems that will avoid one of the problems that motorcycle actually experience is that when they apply brakes, sometimes their tires will jam, and once that happens, it is going to skid off the road. So there are certain systems that are supposed to be in place to ensure that these motorcycles are equipped with devices that will prevent that from happening. Right. So these are standards we're supposed to put. So the third one is road infrastructure. Our roads are pretty bad. We do not have road safety concerns in this road construction when we have a road constructed, and it's actually a big concern. The final part is the post crash response. If we look at the 5, the only part that is actually dealing with the victim of road traffic accidents is the post crash response. So what it means is that we are also following this paradigm of prevention. You understand? So the most of our activities are supposed to be geared towards prevention of road traffic accidents. So if you look at the 5 pillars, 4 of them are actually preventive measures, and the last one is the post-crash response, which has to do with things like ambulance response, hospitals, and where these people are taken care of. Unfortunately, we are not also doing very good here. There are a number of studies done by Kau and Salami, Shola and the rest of them that has actually shown that the pre-hospital care for victims are actually very poor. It's sometimes we have figures as low as 20% of patients, victims who arrive in ambulances into the hospital. And then even in the hospital, how well are we able to deal with these victims? Presently, the one of the globally accepted care for trauma victims is the ATLS. It provides the evidence-based approach to attend to road traffic injured victims. And we do not have enough of people with the capacity to provide that. And we would really need to do a lot. In Nigeria, we have the faculty, yeah, and a lot of things are being done. But at the moment, these things largely just rest on the personal effort of individuals who have the commitment to try and do something on their part. There's a need for the government to put in a lot more effort to support the faculty and the other strategies that are needed to reduce the road traffic, the death from road traffic accidents. So when we put all of this together, it is expected that we might then be able to meet up with the target. The target indeed was to halve the number of deaths from road traffic accidents by 2020. This is 2020. I can tell you that as at 2016, a document was produced by the Federal Road Safety to kind of domesticate the decade of action. And 2016 was already 6 years after the decade was launched. I am not sure, I'm not aware of the document being launched. I am not aware of a national policy with respect to the document. Secondly, as of 2017, I was part of a state committee with Lagos State Committee that was also put up to find a way to domesticate the contents of this document. And quite a lot has actually been done with regards to bringing up policies that will address various aspects of the problem at hand. But again, I'm also not aware that this document has become a policy of government, right? So there's a lot that we need to do, and we all really need to come together to get this, up and doing. If really we want to reduce these fatalities on our roads.
Wow. Thank you so much, Dr. Majolagbe. I think you've said quite a lot of things there. And as you kept, analyzing this thing, I just sat and I thought, look, I don't think we've gone anywhere in this country. I think you're trying to polish it. You're trying to make it sound sweet. There's only sweet about it at all. I think we're still in a hole that we're trying to find our way. And I can still see from what you've said, I can't see a clear future. But I pray and hope that we will be able to, one way or the other, find ourselves in that hole and start figuring out the way. Because you talked about an individual, you talk about the road, you talk about, as in the road itself, and you talk about the vehicle. And I've tried to look at these three aspects. And then we'll talk about the posts, accidents, whatever measure we put in place. When you look at these four things, I think on a daily basis, people are dying crazily. Yesterday, I was driving, on one of our local roads. I'm in Kwara State as we speak, and I drove, for a function. On our way, I saw the road safety. There was a long queue, and then by the time we got there, I saw the road safety lifting somebody into the car. There was a truck that hit a biker who was carrying a lady. Eventually they already moved, so we didn't have the opportunity of waiting. But I could see the events or things that actually happened, the way patients were lifted, they were put in a truck on a very flat truck, and then they whisked the victim, and then off they go to only God knows where they were going. You understand? And then, when you look at things like that, and then even where they were picking these people, these victims, you can see the roads, terrible roads. Obviously, that was what led to maybe the truck was trying to sway and then hit this group of people. And then, as you're talking, I was now relating all this together as a nation. That was just one area. You can imagine how many areas in the country that such will be happening. So there is a lot that is at stake for us. At stake in the sense that, let me go back to that particular patient. This patient is being hit. The accident that had occurred, this patient had to be moved. A lot of people die during the process of moving them. Okay, and I think when you look at our spine, the way it is, which I know I haven't given you a chance to go into details of this, just a small movement can just, lead to the death of the person in an attempt to help. So the public do not even understand. Everybody wants to help. They do not know what it entails when you are lifting somebody, even though you want to help them. During the process of doing that, I'm hoping you help us to throw a bit of light to that, maybe later. In the process of lifting these people, you kill them, or you transfer an injury that is stable to an unstable injury. Somebody can paralyze. and things like that. So these are little things I think as individual we can do. And then from the government angle, you look at the roads, you look at the policy that you're talking about, the documents, nothing. I mean, maybe I'm alien to this, but I can't see things being done. There seems to be nothing in place. And it's a shame because our people are dying. We take it or we leave it. Road traffic accident is a major killer in this country. It's not only killing the poor people, even the elites. The day you leave your house, you're supposed to be the policymaker that are not doing stuff, you think you are immune. I spoke with some people, high caliber people in this country about this topic at some point, and they were telling me that yeah, they have insurance abroad, they have this and that. Then I pointed them to one particular case of a prominent politician. I'm not going to mention names in this same country, who left his house like any other person in the morning. He drove from one state to the other. On the way, while he was just driving a normal drive, the driver in a very expensive car with solid everything, brand new, the tire burst, and then the car rolled over. Whoever is going to help him right there will be the local people around that area. Unfortunately, it was the road that was bad that led to this. And he was meant to be part of the policymaker to make that particular road work. It didn't work. The car flipped. This person unfortunately died from injury, I think abroad. Even though there was insurance, it could have been anybody. So the plea is that, our policymaker would try and look at such documents you've talked about, put strategy in place, not only making, because I know we have so many policies in this country that they're just sitting in one archive somewhere. They're not being, the policies are not being enacted. I asked one driver one day, one of my drivers, and he was driving, and I told him, how close are you to that car in front of you? Said in Yoruba, okay, what is the expected distance between you and the driver
if I will
in
come in
front?
here, no, the first thing is that you have actually painted a gory image, but that's actually the ugly truth of our situation at the moment. And we cannot continue to dwell on it. What we need to do is we need to take action.
Yeah.
All of us have to do something. The government has its role to play. The individuals, we all have our roles to play. With respect to the government, there's an angle I want to bring in. In Nigeria, to a very large extent, we're more like a country that provides a lot of social benefits for our people. Education is quite cheap. It's quite affordable, relatively. People who go to universities in Nigeria, it's quite affordable when you compare to other parts of the world. So what is actually happening is not free. Somebody is paying, the government is paying, it's taxpayers' money. So you are spending so much money. You have spent so much money on training people through secondary schools, the universities, and they start to work, or maybe they're still in the university, spend so much money. And then from a moment dies from road traffic accidents. Just a moment. So what does it mean? Means all this investment. Let us look at them. Everything you have spent on providing education, whatever level of health service that you have been able to provide, that means everything goes into a drain in a single moment, right? So of course, nobody wants that. So is the reason, if we just look at this angle, is the reason why the government needs to take particular attention to address this. The government actually needs to be the driving force, and then the professional bodies need to tag along. With respect to road users, I think, and I remember one of the things that we proposed at the document, the Lagos State document, is that people actually have the awareness of the importance of driving safe is very low amongst people. A couple of years back, several years back, when I wanted to go to renew my driver's license at the road safety office in Ojodu here in Lagos, I recollect that I mean, since it was a renewal, I thought, look, just give me this thing and I will go. I've been driving for more than a decade. And then the VIO official called me and said, Doctor, come, let's have a chat. And then he started to ask me certain questions, which road signs and other things. And I realized how blank I am with these issues. I just realized, wow, so there's a lot of ignorance even with me. And he really sat down, he took his time to put something inside me. And one thing he said that really struck me is that we need to take use of the road as a serious business, be it as a pedestrian, as a driver, a rider, or a passenger in a vehicle.
Mm,
We need to take it as a serious business. Each time we get behind the wheel, you need to have something at the back of your mind that this is a make or mass situation. Anything can happen, and it depends on what you do.
mm,
So sometimes when you look at people who drive and use their phones,
yeah.
right? Some even text, on the phone, while driving. These are very dangerous things. And if you realize the fact that the consequence is it might be death, either you or other innocent road users, then you would definitely try to be more serious when you use the road. Another aspect is this. Um, we need to put even right from the primary school to secondary school level this advocacy about road safety. The knowledge is quite poor. So if we can start it when they are in the formative years, it will go a long way for people to cultivate it as a culture, right? With regards to enforcement, we've had the road safety, we have LASMA, the police, and other agencies of government. Um, and I can tell you, Femi, nobody likes them on the road. Nobody
mm,
likes to see them on the road. When I mean, it's an ugly, it's an ugly sight when it's almost impossible for federal road safety officials to impound articulated vehicles that are we know how often we have these vehicles damage the roads, accidents, and cause fatalities on the road. And
mm,
for the road safety officials to impound them, sometimes it's a battle. It's a very, very tough battle. Remember some time ago when the VIO in
mm,
Lagos were asked to be on the roads, a lot of people complained and said, oh no, what kind of government is this? This is wrong. Actually, it is right. Part of the prescription for managing road safety is to actually have very, very stiff enforcement, to have very stiff penalties so that it can actually be deterrence, right? So the enforcers are supposed to be visibly present on the road, and at the same time, they should also have other covert means of detecting defaulters. The idea of making them visibly present is that a study has actually shown that when you are using the road, when you
mm,
sight an official of government who is enforcing road safety,
mm,
that sense of being safe tarries with you for a couple of hours,
mm,
right? So, and this is something we need the government to also put in place in the minds of those enforcing these laws. It is not about catching defaulters. The objective is actually to prevent them from doing wrong. So sometimes when you see officials of government who hide in corners, sometimes they hide in corners. Somebody is trying to take one way, as we popularly call it, and they wait till you do so before they stop you. It's not it. It is not supposed, the purpose is not supposed, it's not for catching defaulters. The real
Yeah.
objective is to prevent these things from happening, right? So we all hands needs to be on deck. And the postclass response, let me try and draw a little bit into the postclass response. I talked about the ATLS, and I actually alluded to how poor our pre-hospital care is. Even when patients arrive at the hospitals, what facilities are available to take care of them? If we do not put these things in, then we would lose the battle. The post-crash response is supposed to be the last version of this fight. If we do not put these things in, so we need to arm the providers both with the skills and the equipment that they require to save these lives, right? Let me say something. Compared to other health interventions, the lag phase for your intervention in road safety is very short. This is what I mean. A lot of health interventions, when you put in these methods to curtail the ugly trend, it takes a while. You take a number of years before you would be able to see the effect. But for road safety, it has a very short lag phase. For instance, if you put in an intervention like use of seat belts alone, within a span of a year, you will see it when you put up your statistics. When you deal with things like speed, right? Within a year, you will see it. So road safety is something that we can put in so much into, knowing that the reward, it is highly rewarding. You get. So, and the second thing is that it's also um, it's a field in which single intervention actually has rippling effect. You get that rippling
Yeah.
effect on single intervention, right? So I think we need to, put in so much to address the issue of um, prevention, and then also at the last version is the post-crash response. Let me try and make a point, which is important. I quoted a figure, and I need to be careful so that I do not get bashing from the figure that I quoted. I said, according to the 2015 Global Status Report on Road Safety, an average of 4 people died using Nigeria roads. The truth is that the official figure is much less. The official figure, the reported figure, is about 4,000 people that died on the road in
Wow.
Nigeria. It's 4,000. But according to the projection of the WHO, is a lot more. It's about 35,000.
Wow.
This pattern is actually common. This large discrepancy between the reported figure
And
and
actual,
the nation figure. This discrepancy, this large gap, is common amongst developing countries. It's not
yeah.
Nigeria alone, right? So if you look at a lot of other developing countries, it's like that. You realize that the figure they are bringing out, the figures they are turning, it's a far cry from the reality. The reason is that our data collection is very poor.
Very cool. I was gonna say, yeah.
Our data collection is very poor, and this is something we need to invest in, right? Because we need to have audits. For
Yeah.
instance, let me tell you, in Lagos, there is there is a spot that is very notorious in Lagos, the Otedola Bridge along the Lagos Ibadan Expressway, just after the old toll gate. It's very notorious. We get it in a year. We have serious incidences that we have in a year. The minimum we have about 5 serious incidences annually. And when I say serious incidences, I mean incidents that involve loss of lives and things like that. And apart from that, we still get them regularly. It's high time somebody sat and found out what is wrong with that place. Why are we having so much crashes at this point? So you need to audit it. What is the problem? Is it something to do with the road? Is it something to do with the road users? Is it a combination of both? And what can we do? This kind of approach is what we need to address some of the hotspots. And the only way we can do that is when we have reliable data. At the moment, our data collection is poor. They are delays, they are inadequate, and it cannot be used for scientific purposes of intervention, right? So they are actually, you see, the good thing is that there are global templates that has been provided, and these templates are not just for sophisticated countries alone. There are templates that have been provided to address, in fact, the biggest need is amongst the developing nations. So we are the ones that will benefit the most from this template. So for instance, we have softwares that you could install in, palm tops, Android devices that could be used. There's one that is called Radar, Road Accident Data Recorder, that these officials of government can use. It's user friendly. It allows them to put in the relevant data that is needed. It records the GPS of the accident. So when we have all of this, we'll be able to sit back and say, okay, how do we let's have an audit. Where are the flashpoints? And then we can see how do we address these flashpoints. So we need to take action. There are a lot of things
Sure.
that we can do, and there are a lot of advocacy groups. There are youth advocacy groups, and I mean I must also emphasize that the biggest victims are actually people between the age of 19 and 29, right? So the youths are supposed to be encouraged to join these advocacy groups so that we can all put our hands, all hands on deck, to be able to reduce this tide of the road traffic deaths.
Thank you so much, Dr. Majolagbe. So now the last word for the country, your last advice generally, as we round up today's session.
Yeah, my advice is that we need to keep our roads safe. Um, there are a number of things that um, the road traffic accidents is not a respecter of race, of social status, or age. It happens to anybody, anywhere, right? So having that in mind, it is time that we did a lot more with respect to what is on ground. The agencies of government, those officials are doing a lot already, but we still need to get a lot of support. And it is high time that we actually shift this thing to the people themselves. The people need to actually embrace this and be part of it. This is the single most important thing we need to do at the moment with road
Thank
safety.
you. Thank you
You're
so much for joining us today. And to the viewers, we've had a lot from Dr. Majolagbe today. And I hope that we'll be able to, take whatever we've picked here today to also, influence what we do as an individual. We know the road is bad. Let's be sensible. Our cars, let's, take the necessary action, make sure that things are in position, well positioned before, we leave our house. So thank you so much. And then I look forward to seeing us again in another episode soon, maybe next week or maybe during the week. On that note, I say have a nice weekend and bye-bye. Right, we are offline now. So
okay.
good.